My name is Luciano Mariano. I am a neuropsychologist. I'm part of the Global Brain Health Institute cohort 2020-21, and I'm from Brazil and the state of Minas Gerais, Belo Horizonte. I work in two different settings, and there are different ways of working in each one of them. I work in the private sector in Brazil also, and in the public sector. So in the hospital we are all volunteers because in Brazil we don't have neuropsychologists hired by the government. So all this work is done by volunteers. My work is about making assessments and helping to make good and better diagnoses, differential diagnosis specifically. So you assess a patient and then you can check if this patient has a profile of one condition or a different one. When I entered the undergrad course of psychology in Brazil, I had a chance of starting working with older adults from the beginning, and I was fascinated about the work. But then I realized that I really feel comfortable and excited about working with older adults. Mostly because of my grandparents, my grandmothers. They are really fascinating people. They are illiterate, they can read, they can write, but despite of all that, they are really smart women. And I feel like there was this personal interest of making the stories of older adults alive and considered them through the practice, clinical practice and research. And that made me, when I graduate, to pursue this career in neuropsychology, clinical neuropsychology, working specifically with older adults. Dementia is a very tricky concept in Brazil. People are now understanding that dementia is not part of health aging. So people are realizing that older adults are not supposed to get lost or to have memory complaints or to get depressed, but they still don't fully understand what's normal and what's kind of different from what we expect. So there is still a lot of stigma, so people don't understand how to behave, how to deal with the patient, and most of our work is improving and creating knowledge so we can inform people how to deal with the patient and also assist the family to create a better environment. So the first time I came across the concept of involving people with lived experience into the practice and to research was through the Global Brain Health Institute, but I wasn't really interested because it seemed like a very European concept and not really applicable to the Brazilian context. But then I realized that it was very important because it was a way of giving people's voice, of making them be heard. And if I'm making a research and I want to make it sure that this research is relevant, I have to listen to them, I have to consider them. So after some time, because I was doing some very basic, hard science thing like EEG and assessments, I realized, this is too technical. How can I make this, or how can I transform this into something that's more relatable to those who are living with this condition? Because into the clinical practice, this is what we do. We are orienting families all the time. We are orienting the patients all the time. So that's when I realized that PPV, this concept, was really important. So I thought that we could use this program to start making some changes within the structures and within the research framework in Brazil. And I was really lucky because I had a group of fellows, of friends from Brazil who were also interested in doing the same work. And so we got together, and then we start sharing experiences, dreams, and now we have like a plan of implementing next year some kind of PPV initiatives, the first PPV initiatives in Brazil. Yeah, I think that at this point of my particular research, I see PPV as a good resource at the beginning of the process. So, because I work with neuropsychiatric symptoms, and this is quite important and relevant to people, and I see them, I see in using PPV as a way of making their voice be considered right at the beginning, and also in the end when we got the results, because I need to check if those results are really relevant to those who are living with the condition. So I can see for my personal project those two moments in which we can we can really take advantage of their knowledge and their lived experience. And also we have another project with this group of fellows in Brazil, and we are going to do a pilot research with a group of older adults in a community in the south of Brazil, and we are going to talk to them and ask them what's relevant and what they miss within the Brazilian research framework that we could leverage with other partners we have, meaning other institutions, other professionals. And I think that's those two projects are quite relevant, and they will all benefit from this initiatives, this panels. Yeah, definitely, because that's actually one of the problems we have with neuropsychology, for example, in Brazil. We take a lot of tests from the US and we use them with the Brazilian population, and they make no sense at all. So what we need to do is start listening to people and check, so can you recognize this object? Because this is a very American object, and then this is part of the process. But I think that PPV goes further than that. It's not only adapting an instrument, it's actually including the patient. And I think this is quite relevant for what we are planning to do if we are creating a society where patients are, better saying, not only patients, people with lived experience, meaning the patient or the families. If we are creating a better society for them, we need to start listening to them. And not only that, we need to really give them a role to be engaged with us. That's a great question, and I think we have to go back one step, because in Brazil, people are not aware of the PPV initiatives, and the Brazilian research framework is very hierarchical. So you have a principal investigator, you have a lot of doctors involved, and the structure of society does not accommodate people with lived experience talking directly to the principal investigator, for example. Not always, but that's the general structure. So I think that there is a place and there is a role for PPV, of course, but we need to discuss first the hierarchical structure and how we can manage it, because we cannot enter into a confrontation with those who are involved, right? So we need to get everybody at the table and start talking together. And we are still trying to figure how to do this. I think that we need to start inviting people and making them comfortable enough to share their experience, because most of the times they see themselves as an object, an object of interest, not really as a person who is there in the hospital. And so this is a fundamental question. We definitely need to get people comfortable talking about their experience and without patronizing anything they are doing. And I think that that's the first stage. As a psychologist, I can say that that's the first stage. You just need to make the room comfortable and validate their feelings, their experience. And it's a long-term process. Will not happen from one day to another. But I think that that's definitely something we need to do in Brazil.